Welcome back to another video, SWANKY MEDICS. Today we are going to talk about the esophagus, which is a long muscular tube that connects the pharynx to the stomach. The esophagus is about 25 centimeters long and starts at the level of C6, just behind the cricoid cartilage, and it ends at T11, where the esophagus then becomes connected to the stomach. And it does that by passing through a hiatus of the diaphragm, which is called the esophageal hiatus, and that happens at the level of T10. The esophagus is made of three parts: a cervical portion, a thoracic portion, and an abdominal portion. These portions are made of two muscles, skeletal muscle and smooth muscle. The cervical portion is predominantly made of skeletal muscle. The thoracic portion is made of a mixture between skeletal muscle and smooth muscle, predominantly towards the upper portion of the thoracic part or portion. It's made of skeletal muscle. And as you go down, that skeletal muscle transitions into becoming smooth muscle. And then the last part, the abdominal portion, is made predominantly of smooth muscle. The esophagus has two sphincters, an upper esophageal sphincter and a lower esophageal sphincter. So we are going to focus on the lower esophageal sphincter, which is found between the esophagus and the stomach. And its function is basically to relax and contract. So whenever there is food coming through the esophagus into the stomach, the lower esophageal sphincter relaxes, allowing that food to enter the stomach. And whenever it has entered, the lower esophageal sphincter will contract, preventing the content, that gastric content, to move into the esophagus and then getting vomited out. And that's something that happens in certain individuals who have gastritis. The lower esophageal sphincter doesn't work properly, so it doesn't constrict and doesn't close the entrance to the stomach. So all that food, all that digested content within the stomach regurgitates into the esophagus and it gets vomited out. And that's a condition which is called reflux esophagitis. So something worth remembering. So that's all in terms of the structure of the esophagus. And now we can talk a little bit about the histology of the esophagus. Now, the surface epithelium of the esophagus is made of non-keratinized stratified squamous epithelium, and that's found throughout the entire esophagus. But then as you move from the esophagus into the stomach, you're transitioning from a non-keratinized stratified squamous epithelium into columnar epithelium. And then the rest of the digestive system is also made by columnar epithelium. So that's something worth remembering there. Okay, so that's all in terms of structure and histology. So now we can move on into the relations of the esophagus. And if you want to talk about relations and all those structures and organs that are related to the esophagus, we have to separate the thorax into its mediastinae. Now we know that the thorax is made of a superior mediastinum and an inferior mediastinum. And the inferior mediastinum can be further divided into an anterior inferior mediastinum, middle inferior mediastinum, and posterior inferior mediastinum. So, and the esophagus is normally found in the superior mediastinum and the posterior inferior mediastinum. Now, what are the structures that are related then to the esophagus within the superior mediastinum? So what we can find here is that the arc of the aorta, it's related to the esophagus on its left side, and normally on the right side you can find the vena azygos, or the azygos vein. And then you can also see that the trachea, it's found throughout its entire length within the superior mediastinum. The superior mediastinum normally ends at the level of T4, which is also the point at which the trachea bifurcates. So this bifurcation, where you can find the main bronchi, the left and right main bronchi, that's exactly where the trachea diverts, and that's T4. Okay, so those are the relations to the esophagus within the superior mediastinum. So then if you focus on the ones they find within the posterior inferior mediastinum, there are a few there, so worth remembering, and those will be the left main bronchus, which you can see right here, and you can see how it relates to the esophagus. Then you can also find the right pulmonary artery, the pericardium, which wraps around the heart, so you can see the heart right here, and then the posterior sloping fibers of the diaphragm. So these are all contents that are found anteriorly to the esophagus, still within the posterior inferior mediastinum. And then there are certain structures found posteriorly to the esophagus within the posterior inferior mediastinum, and those are the thoracic duct, the hemiazygous vein, accessory hemiazygous vein, and the right posterior intercostal arteries. So those are all the relations found within the superior mediastinum and within the posterior inferior mediastinum. So now we can move on to talk about the constrictions of the esophagus, and there are 4 constrictions. We can start with the narrowest, and that's found at the starting point of the esophagus, at the cricopharyngeal sphincter. So that will be your first and the most narrowest constriction of the esophagus. Then we can move on to the other 3. One is found when it crosses the arc of the aorta. The second one, when it crosses the left principal bronchus or the left main bronchus. And the other one at the opening of the diaphragm, which is again found at T10, so the esophageal hiatus. Okay, so those are the 4 constrictions of the esophagus. Now we can move on to talk about the arterial supply to the esophagus, and that can be divided again into the different parts of the esophagus. So the cervical portion is supplied by the inferior thyroid artery, which is a branch of the thyrocervical trunk. The thoracic portion is supplied by the esophageal branches from the aorta, and also there are branches that coming directly from the bronchial artery that supplies the thoracic portion of the esophagus. And then the abdominal portion, which is supplied by the esophageal branches of the left gastric artery. Okay, so those are the arteries that supply the esophagus. Then in terms of venous drainage, the cervical portion drains into the brachiocephalic vein, the thoracic portion into the azygos system of veins, and the lower portion to the esophageal tributaries of the left gastric veins, which then go on to empty into the portal vein. So that's all in terms of blood supply to the esophagus. Now we can move on to talk about the lymph drainage of the esophagus. And we can do this again based on the 3 parts of the esophagus. The cervical portion of the esophagus drains into the deep cervical nodes, the thoracic portion of the esophagus into the tracheobronchial nodes and posterior mediastinal nodes, and then the abdominal portion goes to the left gastric nodes and celiac nodes. And then finally we can talk about the nerve supply to the esophagus. The upper part of the esophagus is supplied by the recurrent laryngeal nerves and by the sympathetic fibers, which normally comes from the cell bodies found within the middle cervical ganglia. And then the middle and the lower portion, also known as the thoracic and the abdominal parts, they receive fibers from the thoracic sympathetic trunk and the greater splanchnic nerves. Okay, and then there is also an esophageal plexus, which is made by fibers coming from the vagus nerves, from the left and right vagus nerves, and also from the cervical part of the sympathetic trunk. And that provides a mixed innervation, which is basically parasympathetic supply as well as sympathetic supply. So in today's video, we talked about the anatomy, histology, relations, constrictions, blood supply divided into the arterial supply and venous drainage. We talked about the lymph drainage as well as the nerve supply of the esophagus. If you like today's video, make sure to leave a like down below. If you have any questions, make sure to leave a comment down below. and I'll see you guys in the next video.